In this beginner's video, we'll answer the question, what is Medigap? I'll also review Medigap plan eligibility and coverage, why you might choose a Medigap plan, costs, and the best time to enroll. Stay tuned. Hi, I'm Renee Van Staveren. I work with hundreds of Medicare agents across the nation, and I lead Medicare education at Connie Health. Let's jump right into it. What is a Medigap plan? First, it's important to note that Medigap plans are often called Medicare Supplement Plans. You might hear these two terms, Medigap and Medicare Supplement, used interchangeably. Private insurance companies offer Medigap plans, but be rest assured, because they're also regulated by the Centers for Medicare and Medicaid Services, which protects Medicare beneficiaries. The main purpose of a Medigap plan is to supplement your original Medicare Part A and B coverage. And that's because original Medicare Part A and B won't cover all of your costs. Let's briefly discuss Medicare Part A and B. Now, Medicare Part A is your hospital insurance. Medicare Part A covers your inpatient care in a hospital, skilled nursing facility care, short-term nursing home care, hospice care, home health care. Not all of these costs are covered by Medicare Part A. Even if there are Medicare-approved procedures or services, you'll have a deductible and coinsurance costs that are not covered by Medicare. For example, if you have a major accident or illness and it requires that you have 150 days of inpatient hospital care, that could cost you more than $60,000 out of pocket for coinsurance alone. Alternatively, if you require skilled nursing care for 100 days, the coinsurance for that alone could be upwards of $16,000 or more out of pocket. This is where a Medigap plan would step in, and depending on which plan type you choose, could help you pay for all or some of those out-of-pocket costs, saving you $60,000, $16,000. So that is where Medigap plans really come in and fill the gaps in coverage. To learn more about Medicare Part A coverage and costs, I've linked an article in the description below. Now, let's briefly talk about Medicare Part B. Medicare Part B is your medical insurance. Medicare Part B covers preventative services and medically necessary services. This includes care to prevent or detect an illness at an early stage and services or supplies needed to diagnose or treat a medical condition. Medicare Part B covers things like cardiology, radiology, mental health services, screenings for common medical conditions like a mammogram or a colonoscopy, preventative care, including annual wellness checkups, vaccinations, clinical research, ambulance services, durable medical equipment or DME, and limited outpatient prescription medications. Now, this is where things can get pretty high pretty quick. With Medicare Part B, there is an annual deductible. And once you've paid that annual deductible, that's when the cost sharing kicks in. Part B will cover 80% of Medicare approved services and procedures or durable medical equipment, but your coinsurance responsibility would be the 20%. Now, with original Medicare Part A and Part B, there is absolutely no cap on the out-of-pocket maximum, which means you could keep paying and paying those out-of-pocket coinsurance amounts until, well, forever. If you have a serious accident or a serious illness, these costs can add up really quickly. Now, to learn more about original Medicare Part B, I've linked an article in the description below. You can also find a video within our Medicare for Beginners playlist if you'd like to check that out as well. To reiterate, original Medicare Part A and B do not have a cap on out-of-pocket costs, and a Medigap plan can help you pay for some or all of those costs that would normally be out of your pocket. Now, how are you eligible for a Medigap or a Medicare Supplement Plan? You must be enrolled in original Medicare Part A and B to be eligible to apply for a Medigap or Medicare Supplement Plan. Now, just because you're eligible for a Medigap plan doesn't mean that you'll necessarily be able to enroll in one. And we'll talk about why in just a bit. First, let's talk about what Medigap plans cover. Medigap plans cover the out-of-pocket expenses not covered by original Medicare. These could include deductibles, coinsurance, copayments, and other out-of-pocket costs. Now, depending on the Medigap plan, the plan pays for some or all of the Medicare approved out-of-pocket expenses you would typically have to pay without a Medigap or Medicare Supplement plan. A Medigap plan's job is to help you pay for high or unforeseen out-of-pocket costs. There are 10 standardized Medigap plans to choose from. These include Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, Plan K, Plan L, and Plan M, and last, Plan N. Now, while there are 10 plans that are standardized and available, plan availability does vary from state to state. So you can go ahead and check with your local licensed Connie Health agent to see which plans are available in your area. Each plan type offers a different combination of coverage and benefits. So assess your healthcare and budget to determine which plan suits your needs best. If you'd like to review each of these 10 plans and their coverage, I've linked a helpful article in the description below. The article includes a table that breaks down coverage so you get an idea of what might be best for you. I truly hope that you're finding this video to be valuable. If you are, take a moment and hit the like button below and watch this video till the end, where I'll share more helpful links to support you on your Medicare journey. Now, let's get back to the video. Now, many people ask about Medigap plans and prescription medications. With a Medigap plan, you must purchase a Medicare Part D standalone prescription drug plan. Prescription medication coverage is not included in a Medigap plan. If you'd like more information about Medicare Part D, I've linked a comprehensive article in the description below. Alternatively, there's also a video that's linked within our Medicare's for Beginners playlist. Many people new to Medicare ask, do I need a Medigap plan? And for good reason. You want to make sure you weigh your options. Now, original Medicare doesn't have a maximum for their out-of-pocket costs. This could put you at financial risk and even lead to medical debt. Because there's no maximum out-of-pocket, we recommend that everyone have supplemental Medicare insurance, either through a Medigap or Medicare Supplement Plan or a Medicare Advantage plan. These plans work differently, and in this video, we're only covering Medigap plans. However, if you'd like to learn more about Medicare Advantage plans, I've linked that video in the description below. Now, here's why you might choose a Medigap plan for your needs. Medigap plans work alongside original Medicare Part A and B, covering some or all Medicare approved out-of-pocket costs. If you face a serious accident or illness and you don't have savings put away for, say, catastrophes or catastrophic coverage, you could face a large financial burden. If you choose to have only original Medicare in one of those circumstances, you could be putting yourself in a financial and health hardship, having to make really tough financial or healthcare decisions when the only thing you should be worried about is your health recovery. A Medigap plan enables you to keep your original Medicare. It enables you to see any provider that accepts Medicare assignment and enables you to see providers out of state if you travel a lot, or maybe you just want to go see someone who's a specialist out of state. These are all possibilities. And this is what makes a Medigap plan super flexible. So a Medigap plan might be a great option for you if you travel a lot or you want maximum provider flexibility. Now, let's talk about the cost of Medicare supplement plans. Let's start with the premium. Every Medigap plan has a monthly premium. Premium cost of your Medigap plan will be determined by the state that you reside in, the plan type you choose, your age and sex, whether you smoke, and your insurance provider. While there are 10 standardized plans to choose from, and they must all offer the same benefits no matter the insurance provider. That does not mean the insurance premiums will be the same. As you're comparing Medigap plans, keep these two tips in mind. Insurance companies can have different rates. If you find a plan that you like and it doesn't fit your budget, consider other insurance companies that may offer a lower premium. Remember, even though plans are standardized and benefits must be the same no matter the insurance company, the cost for the premium does not have to be. Those vary. Now let's discuss Medigap out-of-pocket costs. And you might be asking yourself, wait, I thought Medigap was supposed to pay the out-of-pocket costs. That would be a great question, because Medigap plans have a matrix of benefits. Keep in mind that Medigap plans pay for some or all of your out-of-pocket costs. So some Medigap plans don't cover all of the copayments. Some require that you pay coinsurance costs, while some cover deductibles and some don't. Some plans also have an out-of-pocket maximum. With up to 10 plan types to choose from, you need to weigh whether or not you want maximum coverage at the highest premium cost, or if you're willing to pay out-of-pocket for some things in order to have a lower monthly premium. When reviewing plan types, you should review the coverage of Part A and Part B's copayments and coinsurance, deductibles and out-of-pocket maximums, excess charges, and more. Connie Health wrote an article that includes the Medigap plan matrix, as I call it, that really goes into a lot of detail about the different types of coverage that you might be looking for, making it easy to review what each plan type covers. And we've linked that article in the description below. Now, how do you find the best Medicare supplement plan for you? Choosing the right Medicare supplement plan or Medigap plan depends on your unique health and budget needs. Ultimately, look for a plan that provides the healthcare coverage you need without straining your budget. Now, this is a really important tip that could save you a lot of money in the long run. Do not neglect reviewing historical rate increases. A plan with a lower premium upfront, but historically high premium rate increases may cost you a lot more in the long run. If you'd like help reviewing your Medicare Supplement Medigap plan options, a local licensed Connie Health agent can help. They can provide valuable guidance tailored to your health and budget needs. Remember, the best Medigap plan meets your healthcare needs and aligns with your budget. Now, let's discuss the best time to apply for a Medicare Supplement Plan. The best time to apply and enroll in a Medicare Supplement Plan is during your 6-month Medigap open enrollment period. This 6-month Medigap open enrollment period is unique to you. Your Medigap enrollment period begins the month that you're 65 or older and you're enrolled in Original Medicare Part B. The Medigap open enrollment period is critical because it provides you guaranteed issued rights. That means if you have an existing or pre-existing medical condition, they can't require underwriting to either prevent you from getting a policy or enabling them to charge you more. Now, the downside is that if you miss your 6-month Medigap open enrollment period, you may be required to undergo medical underwriting. Now, this process of medical underwriting could prevent you from enrolling in a Medigap plan or cost you significantly more. There are some states that have protections for extended Medigap enrollment periods, so you may be in one of those lucky states. A local licensed Connie Health agent can help you determine your Medigap open enrollment period, whether or not you have an extended enrollment period, and also whether or not you can enroll in a Medigap plan outside of your Medigap open enrollment period. Connie Health wrote an article that shares Medigap's coverage, plan types, costs, and enrollment details that makes enrolling super easy. To read about Medigap plans, visit the link in the description below. In this video, we answered the question, what is Medigap? I also reviewed Medigap plan eligibility and coverage. why you might choose a Medigap plan, costs, and the best time to enroll. Connie Health is here to support you throughout your Medicare journey. If you like this video, hit the like button. If you want more videos like this, subscribe to our channel. For more Medicare videos for beginners, see the video link in the description below. Until next time.